Hello everyone, welcome back to 4x11. This is second part of the video series on acute pancreatitis imaging, and today we are going to discuss about fluid collections in pancreatitis. Whenever there is acute pancreatitis due to pancreatic or peripancreatic inflammation or due to rupture of pancreatic ductal branches, there is development of fluid collections within the abdomen, which are an important cause of morbidity in these patients. Here is an image showing a contrast-enhanced CT of a pancreatitis patient, which shows a fluid collection posterior to pancreas in the left anterior pararenal space as marked by the arrow. Here is another image showing small fluid collections in the parasplenic region and along left anterior pararenal space as marked by the arrows. Now look at this collection. It seems a bit different than the previous two images. And the reason is that it has this nice well-defined wall. This happens when the acute fluid gets organized over time and develops a wall and is now termed as pseudocyst. So yes, it's a case of pseudocyst which developed due to pancreatitis. Here is another CT showing a pseudocyst with a well-defined wall. A time period of 4 weeks is taken as per revised Atlanta criteria to differentiate between acute pancreatic fluid collection and pseudocyst. Multiple pseudocysts can be seen in this image marked by the white arrows. However, take a look at this, the hyperdense collection marked by the orange arrow. Well, this was hemorrhage that developed as a complication. We are going to discuss about complications of pancreatitis in our next video. Now, there is a curious thing about pseudocysts. They can be seen at very far off places in abdomen. And not just that, they can extend superiorly into the mediastinum and even up to the neck. Here is such a case showing a pseudocyst extending into the mediastinum marked by the red arrow. Here is a flowchart summarizing the collections in interstitial edematous pancreatitis. If the collection is acute, that is less than 4 weeks, and shows no well-defined wall, it is called as acute peripancreatic fluid collection. However, if the collection is more than 4 weeks old and shows well-defined wall, it will be termed as pseudocyst. Remember that both pseudocyst and acute peripancreatic collections develop in the interstitial edematous pancreatitis and are homogeneous with no solid debris or necrotic content. Now look at this image. We have fluid collection here also, but what is different here? We can see small fat density areas within which are marked by the yellow arrows. These represent fat necrosis, thus it is a necrotic collection. Here is another collection, it looks homogeneous. Is it acute peripancreatic fluid collection or necrotic collection? We can see that the fluid is homogeneous, no solid debris is seen, nor any fat contents. But we can see that the pancreas is necrotic. Loss of pancreatic parenchyma is seen in the mid-body region, and therefore we would call it acute necrotic collection. And so the takeaway is that any peripancreatic collection associated with pancreatic parenchymal necrosis should be termed as acute necrotic collection, even if it is homogeneous and contains no non-liquefied debris. And now we see another necrotic collection, but we can see that it has a wall around it, the way pseudocysts develop wall around them. In case of necrotic collections, we call is as walled-off necrosis. So this collection is walled-off necrosis. Here is a flowchart summarizing the collections seen in necrotizing pancreatitis. If the collection is acute, ill-defined with no wall around it, it's called as acute necrotic collection. And with time it becomes organized and develops a well-defined wall, and is then termed as walled-off necrosis. So this was a relatively small discussion on collections in acute pancreatitis. In our next video, we are going to discuss about the complications of acute pancreatitis. Thank you guys. Have a great day.